Hi, my name is Brian Jose Luceño Quijije, and I'm going to talk about case 32, 2019, a 7-year-old woman with rapidly progressive ataxia. Definition: sporadic Creutzfeldt-Jakob disease is the most common human prion disease and has a broad of heterogeneous spectrum of manifestations. The cerebellar form of Creutzfeldt-Jakob disease is characterized by a cerebral syndrome with no evidence of cognitive impairment in the first month of illness, and it can account for approximately 20% of cases of sporadic Creutzfeldt-Jakob disease. The mean age at onset is 60 years, and the first symptoms that occur are most commonly gait dysfunction, dizziness, and incoordination, all of which are consistent with this patient's presentation. Cognitive impairment occurs a mean of 3 months after the onset of ataxic symptoms, a clinical course that closely matches this patient's course. Other neurologic features such as pyramidal signs, myoclonus, or vision impairment become evident with progression.
This is a book all our scrapbooking friends made. She loved dragonflies. It's got the dragonfly.
For Kip Lavin, the warm memories of his 17 years with wife Michelle well up just as quickly as the tears of loss.
She always had a smile. Her laugh was great. She was great. Really miss her.
In March of 2011, 42-year-old Michelle experienced a sudden onset of stroke-like symptoms, difficulty speaking, confusion, and odd movements. All tests came back negative, and she was sent home, but Michelle was still struggling.
Everything was not working. She'd put her shirts on backward.
Within a few days, Michelle was back in the hospital to stay. Stroke and meningitis were ruled out. Kip says primary care doctors and specialists were stumped. And then, without the chance to ever say goodbye, his wife was gone.
40 days, I think, from the beginning to the end, it was done.
The diagnosis, Creutzfeldt-Jakob disease, CJD. There is no treatment, and it is always fatal.
We call rapidly dementing illness. That's something that affects cognitive skills, memory, thinking, behavior, and it comes on rapidly.
Mayo Clinic neurologist Dr. Alan Axemet says an abnormal infectious protein called a prion is believed to be the cause of CJD, actually creating holes in and around neurons in the brain.
It co-opts the normal protein, and then it becomes a self-replicating or self-amplifying process, which essentially kills neurons and gets transmitted to other neurons in the vicinity.
Dr. Axemet says 90% of cases are sporadic, striking spontaneously without a known cause. The other 10% are familial, which was Michelle's case. Kip says that means their sons Cody and Devin have a 50-50 chance of developing CJD, a possibility he finds very hard to bear.
The normal person, if you knew you had it, you couldn't get married, you couldn't have kids,
Since CJD affects just 1 in a million people, research is slow to progress, yet that is Kip's only hope of erasing the long shadow cast by a dreaded disease. For Mayo Clinic News Network, I'm Dennis Doda.
Applications in medicine. A 60-year-old woman. On examination, the patient had marked dysmetria bilaterally on finger to nose and heel to shin testing. Severe dysdiacokinesia was also noted. The gait was wide-based and unsteady with truncal ataxia. The remainder of the examination was normal, including repetition and naming strength, deep tendon and plantar reflexes, and sensory function. A lumbar puncture was performed, and tests of paraneoplastic antibodies in the blood and cerebrospinal fluid were negative. 3 weeks after discharge, the patient was evaluated in the Ataxia unit. Her gait and coordination had worsened. She could no longer ambulate independently with a walker and required one-person assistance. New dysarthria have developed, along with short-term memory loss. She began to forget conversations held earlier in the day. Oculomotor examination revealed occasional square wave jerks in the primary position, slowed pursuit movements with frequent saccadic intrusions, hypermetric and hypometric saccades, and male gaze evoked nystagmus in the horizontal plane.
Said you got some hallucinations from that as well, is that right? Yes. Do you mind if I just test the effect of a bit of a noise, bit of a clap, not too loud? Yeah. All right. Sorry about that. I won't do it again. And that's just been for the last couple of months, is that right? That's not a lifelong thing or anything? No. Used to work in construction. Oh, jackhammers.
Pros and cons. Pros. She didn't smoke tobacco or use illicit drugs. There was no family history of ataxia, dementia, autoimmune disease, or neurodegenerative disease. Blood levels of electrolyte glucose, arsenic, lead, mercury, and cadmium were normal, as were the results of kidney function testing and urine toxicologic screening. Cons. She had a history of hyperlipidemia, impaired glucose tolerance, and asthma, and a long history of mild hearing loss. Medications include simvastatin, vaginal estrogen, and has needed lorazepam for insomnia. Issue applied in Ecuador. Creutzfeldt-Jakob disease may be classified as sporadic, familial, or acquired, with the sporadic form accounting for approximately 85 to 90% of cases. The prevalence of this disease in the United States is 0.5 to 1 per million inhabitants. So far in Ecuador, we don't know what the prevalence or incidence is, and there are six cases, but only one case report has been written.
Welcome. My name is Professor Peter Panagouris. I'm a neurologist from Perth in Western Australia. Research Proprietary Limited, a company devoted to the understanding of neurodegenerative disorders and their treatments. Today, we're going to talk about prion diseases. Prion diseases are a devastating group of neurological disorders characterized by spongiform degeneration and neuronal loss. Patients with spongiform encephalopathies develop devastating neurological disorders characterized by dementia and ataxia, leading to rapid death within a few months to up to a year. Such disorders include Creutzfeldt-Jakob disease in both familial and sporadic forms, Kuru, variant Creutzfeldt-Jakob disease, and transmissible form of prion diseases. Prion diseases are formed by misfolding of physiologically known prion proteins known as PRPC that fold into PRPSC. It is the PRPSC that forms the pathology. In this paper, we talk about development of new treatments for prion diseases that involve immunological therapies. This is an exciting development because the formation of prion diseases by misfolding of proteins and spread throughout the brain is not only relevant to prion diseases, but also become increasingly recognized as relevant to Alzheimer's disease, involving A, beta, and tau, Parkinson's disease involving alpha-synuclein, multisystem atrophy also involving alpha-synuclein, frontotemporal dementia involving tau and TDP, and other neurodegenerative disorders.
Conclusion. The histologic examination was performed. Immunohistochemical staining for 3F4, the monoclonal antibody to prion protein, revealed granular deposits in the brain. In the context of the autopsy findings, the findings on immunohistochemical analysis verified the diagnosis of Creutzfeldt-Jakob disease. It evidenced spongiform degeneration in the basal ganglia, thalamus, and cerebellum, with the neocortex less affected. Definite diagnostic must be histopathological. There are ancillary tests currently available that have allowed to obtain a diagnosis of the disease.
So what is CJD and how can it be spread? 12 News' Colleen Henry has been investigating. She continues our live team coverage from the WISN.com center. Colleen.
Kat, Creutzfeldt-Jakob is a degenerative brain disease. It has no cure, and it is always fatal. The good news, though, is that it affects only about 1 in a million, and it's relatively difficult to transmit. Now, the experts say there is no evidence CJD is contagious through casual contact with someone who has the disease. It can't be transmitted through breathing or touching. However, CJD can be transmitted through exposure to infected spinal cord fluid or brain tissue, and that's the issue at Froedtert. Traditional sterilization does not kill CJD. The surgery that occurred on Monday was neurosurgery involving the brain, obviously. That's why the hospital has undertaken a bleaching process. It is a protocol recommended by the World Health Organization and the Centers for Disease Control to prevent cross-contamination and infection to both the patients and the staff at hospitals. Experts say such cross-contamination is very rare and that most cases of CJD are hereditary.
Now, Colleen, this is not mad cow disease.
No, CJD and mad cow are actually in the same family of diseases caused by so-called mutant proteins. They have similar symptoms. They're both fatal. Early on, in fact, some suspected that they were the same disease, but scientists have determined that mad cow is caused by a mutant protein particular to cows. Humans have, however, contracted mad cow by eating tainted meat, but in this situation, this is not mad cow. It is a different form of disease.
Thank you.